Thanks, everybody. Really glad to be here. Looking forward to an amazing conversation with two gentlemen who I know very well. As a quick introduction, I'm Drew Shiller. I'm the CEO of Validic. Validic is the leader in connecting consumers with healthcare organizations through data. So we connect data from in-home monitoring devices, wearables, health apps on the phone, into the healthcare system and clinical workflow to actually drive initiatives like remote monitoring and remote patient engagement, health and wellness initiatives, and clinical research. And the two gentlemen who I'm here with today, I've worked with directly over the last several years on some really amazing work, and that's really gonna spotlight the stuff that they've been working on. So first, Steve Van, who's directly to my left here. I got to know Steve through a program that was funded by PCORI. It was a research demonstration to showcase how patient-generated health data can actually improve the quality of patient care. And that was produced in part for the Office of the National Coordinator for Health IT. And in that program, what we did was we captured data from glucose monitors, blood pressure monitors, and other apps and devices, and brought it into the clinical workflow to enable proper care for patients with diabetes. And Steve will share how that really impacted his life. And then Dr. Mike Swirnick and I've been working together now for a few years on a program that he really conceptualized with Kaiser Permanente to really demonstrate how diabetes care specifically, but also chronic conditions in general, can actually be used and scaled throughout a large organization that has millions of patients like Kaiser Permanente. And we're happy to say that this is now a very successful, widely scaled out program across multiple regions within Kaiser Permanente. So with that, Mike, why don't you go ahead and introduce yourself a little bit further to the audience?
Sure. My name is Mike Swirnick. As Drew mentioned, I'm an internist and informaticist, and I work for in the Southern California region of Kaiser Permanente, which is the largest region. Us in Northern California are about the same size. We have about 4.5 million patients, about 450,000 patients with diabetes. Nationally, Kaiser has about 12 million patients and operates in 8 states plus the District of Columbia. And our program has, we've enrolled about 20,000 patients so far, which is the largest within Kaiser Permanente, and I believe one of the largest in the country, if not the largest.
That's great. And Steve?
And my name is Stephen Van, and I'm the patient. I'm the person that went through one of these programs and found a very successful end. I'm a father, husband, wife's in the audience, and I am a program and project manager in the Bay Area, but have found success as walking through one of these remote monitoring programs, actually developed by Validic.
Yeah, thanks, Steve. So let's jump into the questions. So Mike, can you provide an overview of the remote care programs you've launched with Kaiser Permanente and help everyone understand how these operate, what they look like for patients, and how you've been able to really scale these?
Sure. So before I describe it, what I'm talking about is specific to the Southern California region of Kaiser Permanente. Like all of our innovations, this is being scaled out in the other regions according to how they prefer to do it. So it may look different in different regions. But for us, although it's available to all of our clinicians, we really designed it to fit an existing program which uses diabetes care teams, which consist of a diabetes care manager or a case manager, which is usually a nurse or a pharmacist. And they're connected with a primary care physician or an endocrinologist, and they can provide more day-to-day care for these patients. And the way it usually works is a patient's identified as being not well controlled. The care manager reaches out to them, usually by telephone or email, or they may do in-person visits. So most of ours, I think, are virtual encounters. And they initiate a series of discussions. It's usually every 2 weeks on average, and hopefully within 3 to 6 months, the patient's under better control. So we built it to integrate with that pretty seamlessly. So instead of a regular glucometer, they get the Bluetooth glucometer. The clinician during that initial encounter will determine if the patient's qualified, and if so, they'll describe the encounter. They enroll them within our electronic medical record, give them the glucometer if they need it. And then the patient on their end goes through a web-based consent process, sets up their phone and their app and their meter, and then starts submitting data. The care managers then get this data directly in our electronic medical record because it's integrated there, and they provide the care as they usually would. And 2 points to that. I think one is that aside from the initial enrollment, which is a little bit of time investment for everybody, after that it's time saving. So the patient can do all this stuff at home now, which is great. And the care managers, although it's a little more subtle, the fact that the data is embedded in the electronic medical record already makes a lot of their work much simpler and much more efficient. And the other piece is that's been critical to our success is that we have a robust support system in place for both the patients and the clinicians, so the patients can contact them. And also during the enrollment process, we've identified a couple of potential sticking points that we'll proactively reach out to the patients to help them through if we think they might be stuck with something. So we've had previous programs that didn't have that, and they were not as successful as the one we have now. I think that's key.
Yeah, that's great. One quick question. So we just heard from Verily, who said we're going to have something like 1,600 times more health data than has ever been available. And so when you think about that, and you think about all of the patients who are now able to easily, seamlessly bring capture readings and have that delivered into the clinical workflow, how do you and how does Kaiser Permanente think about how to separate signal from noise? 'Cause that's one of the big learnings in working with your organization for me is that I think you guys have a very strong thought process there.
Yeah, so if you start thinking about the numbers, it gets overwhelming. I haven't looked in a long time, but we have probably tens of millions of readings in the system. But the trick is we don't show the clinicians the raw data, obviously. They don't have time for it. It's not their interest. And so for people who are fans of Tufty, you know what I'm talking about. You really want to condense this data in a usable way that makes it clear what the patterns are, because a lot of the clinicians are doing pattern recognition on this data. And if you look at like CGMs, which are they continuously generate data every 3 to 5 minutes, so it's like 300 to 500 readings a day or something like that. And we don't show all of that. We show curves and we display it over a week. So it's a challenge of data visualization and coming up with the right view that is clear and helps the clinicians make the appropriate clinical decision.
Yeah, absolutely. One of my favorite alerts that we have in the system is that if a patient doesn't record a reading, that's really important, but how do you show that in the workflow? And so what we do is every 24 hours that a patient doesn't record a reading, the patient gets an SMS that says, take a reading, but nothing goes back to the clinical staff. And every 24-hour period, the patient receives an SMS that they don't take a reading. But if 7 consecutive days go by where a reading's not taken, then because you're working with Epic, an in-basket alert is sent to the clinical staff. And then they see, oh, this patient's really out of compliance, and now they really know to intervene. So it's a really good signal to noise ratio.
Yeah, and some of that too can be a technical issue too, so that notification to us helps trigger a technical support process if it's technical, and it might just be the patient needs reinforcement to take their readings or.
Yeah, that's a great point. And so Steve, I'd love to hear your experience. What's your experience been like being in a remote monitoring program like what Dr. Smyrna is speaking of?
Speaking to it from this point of view, as a patient, it's been a fantastic communication experience, number one. As patients, we don't really know what to do. I know that I had been a diabetic for 20 years. I had been going to the same endocrinologist, trying to push my numbers down. Felt like I was trying to eat the right way, get out there and exercise. Stuff to do with a career and life and family, but you do it, right? But I didn't have a way. What this process did for me is it gave me a feedback loop. I began to have a different conversation with my healthcare team. We had a dialogue, not a monologue. It was two-way, not one-way. So, from a patient, from my point of view, I was able to collect my data on a regular basis and push it back, and it provided the communication I needed of what to do. It provided a roadmap on how to get there. Because once again, as a patient, we'll do what we think we need to do, but just going out and exercise and eat leafy greens, it's not it. We need to have something behind that. Providing the information of when I'm high, when I'm low, that my blood sugar, that my blood pressures, when they're high, when they're low, and how to begin to modulate them, and how to begin to relax, how to begin to take a look at my blood sugars in detail. what does 200 mean? I know what it feels like. What does it mean, right? Feedback loop, great communication, better communication, and an understanding of what I need to do.
Yeah. Could you share with the audience your aha moment, which internally at Validic we call the popcorn story?
Yeah, I would love to. I was in the program. What you had to do is you had to capture your data and feed it back through this machine. I call it a machine because I use my iPhone and I capture my glucose whenever I take it. It's just one more step. For my point of view, it wasn't hard work. It was just the last step of the steps that I already do. So after capturing the data and sending it up, I would go in and meet with my care team. And I was meeting with my endocrinologist group, and they were looking at the numbers, and they said, Steve, what's going on in the evening? Every evening, your numbers appear to be, rising. And I said, well, wait a minute, I've got a good dinner that I'm eating. It's nice and well balanced. I make sure that I've got not too many sugars. And they said, well, what are you doing around 8, 9 o'clock? And I said, well, my wife and my kids have gone to college right now, so it's the first time in a long time we've had a chance to be alone. We got a Netflix account, and we're starting to watch movies that we like. I pop some popcorn, and we have that, and that's it. And she said, Steve, you're having popcorn. I said, yeah, well, don't you? Yeah, popcorn's healthy. What's wrong with popcorn? Popcorn is fine. It's not the big buttery, salty kind. It's just kind of natural popcorn. And she said, Steve, that's corn. She said, that's you're putting sugar. And what that did for me was, wait a minute. What I thought was healthy, it's not healthy. I mean, I really didn't know before that popcorn would elevate my blood sugar at such a rapid rate and for, a sustainable amount of time, as much as I was eating. So it changed the way I thought about food. It took me by surprise, but it also made me look at every little thing that I eat. And as I began to look deeper at what I thought I knew versus what the truth is and what that balance was, it was out of balance. And then I was able to change my behavior, the way that I not just approach food, but the way that I looked at the detail of the food. Because it was very clear that what I was eating was keeping my blood sugar high. That feedback that I got from my care team on a regular basis, really, for me, it changed my life. It changed the way that I live my life. It changed the way that my health is and the way that I can carry forward from here.
Yeah, and without the data, it wouldn't have been possible.
I had no idea. Yeah. There's one statement I really want to make. From a patient's point of view, we guess. We don't know. We think. I bet, 60, 70% of diabetics out there guess at what their food is. If they could know and have direct feedback, that is a change. And I'll share my change later, but that is, from the patient side, that is what we need.
Yeah, that's amazing. Thank you. Mike, remote monitoring programs are not new. They've been around for 30 years. So I'd love your perspective on what's different now, what's new, what's happening to cause patients to really get engaged in new ways and health systems to really start to leverage more of the continuous data that's available.
Yeah, I mean, pardon me, obviously the technology has advanced quite significantly, so that's kind of opened the door to this sort of thing. The glucometers and other devices have Bluetooth, and we all carry a phone, which is a conduit to the internet, so we can do these things in a cost-effective way now. But the other part of it is, I think, more of a focus on chronic condition management and the idea that keeping patients healthy is more cost effective than having them come in when they're not healthy. And also the time pressure that clinicians are facing now. It's what we constantly hear from clinicians is, I don't have time, I don't have time, I don't have time. So for us, we've had probably 5 programs before the current one, and in a couple of those we looked at how much time we spent on this, and the change was pretty remarkable actually. The care managers that were using telephone encounters for these things, remote monitoring cut the average length of the call from 15 minutes to 5.5 minutes. Wow. So it's like a 60% reduction in time, which is huge, and it makes sense because this is a lot of data that you need to verbally communicate, and remote patient monitoring allows that to come in automatically. And aside from just that obvious benefit, the other benefit there is that now these virtual types of encounters are more attractive to clinicians who were having patients come into the office, and so now they're shifting more to doing these virtual encounters and benefiting from those time savings. And I'll just mention that one example is our gestational diabetes group, which is gestational diabetes is a usually temporary form of diabetes that women get during their pregnancy that lasts till the end of their pregnancy, and it's a very high-risk condition, so the management of it's very intense. They have to take their blood sugar 4 times a day. They have to come into the office every week. My wife was pregnant recently, and the last thing she wanted to do was come into the office every week. So we've been able to save them trips to the office with this technology, and you can see it in our data. The patients really love it. They're the most engaged group that we have, and the clinicians have enrolled a very disproportionate number of these patients. About 20% of our enrollees are these patients. So I think it's very attractive to patients, the time saved coming in, and they appreciate just having this more interactive dialogue with their care team than they could when they were coming in every month or 2.
Wow, that's so great. I really appreciate that. And so, Steve, I'd love to hear from your perspective. You mentioned that you wanted to share a little bit about how this has really changed your life. I'd love to hear
Man.
I mean, the story of the gestational diabetes is really, really fascinating, but how has this impacted you?
So for me, what it has done, it's done several things. Number one, it's helped me get closer to my health. I understand what my numbers are. Before, I really didn't understand what they were. I knew the numbers, but I didn't know what they meant. I took my A1C from 8.5, 8.6. I just had it tested last week before I came here. I'm about 6.7 right now. That's great. That's life changing. What that tells me is that I'm going to extend my life. I mean, I love my life now. There was a point in which I just really didn't like it. And when I say I didn't like it, it's because I was unhealthy. I'd walk around every day. I was carrying around excess weight. I couldn't sustain a full day. I ended up having to work part-time because by 3 o'clock I was just worn out with blood sugars going out of whack and hypertension and all that. But as a result, I lost 50 pounds, dropped my A1C 2 points. My blood pressure, I'm so proud of, I can't believe it. I can't even believe that I know what that means, that I know what it means, right? And I'm able to live a better life. When I say I love my life, I love my life. I love the energy that I have. Walking around here in Vegas, you have to walk everywhere, up and down the steps. I went out for a walk this morning. I feel good about me. I got my life back. And I thank that process every day. What it did is it gave me a way. It gave me a process. You were talking about noise before. We hear noise as a patient. Oh, just go eat leafy greens. Oh, just go work out. Well, what does that mean, and how do I do that? What this process did is it also gave me a chance to have that dialogue with my doctor, right? Because I got closer to what those numbers were because they were communicating to me. My care team was holding my hand along the way, like you were talking about. That matters, right? I can manage my own health now. I no longer give my health to my doctor. I used to walk in and say, fix me. No, I don't do that. It's my health. We're a partnership in this. We get to have a dialogue about this. We use the data as the language that we communicate by. I can't believe it, and it's changed my life. My kids know it. I've got young kids in college, and they see it. My wife sees it. My work sees it, and as I say, I thank myself and the team that I was part of in Validity for giving me my life back. Without something really bad happening, because I think I was on my way. But it's a gift every day that I take with me, and I thank you. Appreciate it.
Yeah, well, thank you. I'd love just really quick for parting thoughts from the two of you, and maybe Steve, you can just spend 30 seconds on this, and then Dr. Smyrna, I'd love to hear from your perspective. How do you think about being engaged in these programs? Because I know you've told me before, you want an engaged patient, you got one. And Dr. Smyrna, I'd love to hear from you. What is engaging about these programs from a clinician perspective? Like, why are we seeing such a strong pickup in your organization? Steve, we can start with you on the patient side, and then.
For me, I was looking for something. I was unhealthy. We know. As a patient, as a person, you know that you're not healthy. You know something's going on. These programs give you hope, give you a way, give you an opportunity that you just don't have. And I was very fortunate. I thank my lucky stars every day to be able to have been part of it. So for us, it gives us hope, gives us a way forward to better health.
Yeah, and you shared with me that you had even gone to trying to fax your glucose readings, right?
Man, yeah. There's, the problem with getting in a program like this, it's like getting on, it's like getting on a treadmill that you get on every day. If they take the treadmill away, what are you going to do? Well, you're just going to walk then, right? So now, I don't have, I'm not part of, my healthcare system doesn't have this. Which I tell them about all the time. So I have to bring the information in. I literally have faxed it into my doctor, and I create my own health data all the time. I walk in with a report from my CGM and be able to let them take a look at how I'm doing. Because because without it, I can only go by the A1C and fasting glucose that I get from the lab. But when I bring my data in, I think he's more informed, and so am I.
Yeah, thanks for that.
For us, I think it's really simple. Clinicians went into the field because they want to provide better care, and this gives us a way to do it. And so I don't think there's any more magic to it than that. If we design it right so they can, they're going to adapt it really quickly, which is what we've seen.
Yeah. That's so great. Yeah, one of my biggest takeaways from the last few years of working with the two of you on these different programs is that clinical team members and patients are so aligned fundamentally in the goal of having better outcomes, and yet so many things in healthcare all the time end up sort of getting in the way of that happening. But at the basal level, everybody is really aligned. And so I'm really happy to see so much success that we're having. So, well, thank you guys very much. Please join me in thanking Dr. Swernick and Steve.
Thank you.